Thank you for joining us today on Community Conversation on What's Up Prince William. Today we have Summer Watson and Sheila Kirkbride from the Warrior Research Foundation. Thank you for being on the show today.
Thank you so much.
Thank you.
So tell me, what is the Warrior Research Foundation?
And to tell you a little bit about us, what our mission is to identify the mental and physical needs of our veterans and their families. And the way we do that is through research, through needs assessments, and just talking to the veterans themselves rather than assuming what they're going to need. We actually use research to be able to identify what they need and then develop programs or work with other organizations to meet those needs that are identified.
And how did you get started?
Well, the way that we got started was through a campaign called Drive for Life. And Shelia and I met, and we decided that there was a need in relation to identifying why the rates of veteran suicide continues to rise. And so we decided as a team to go across the country. So we drove from DC to California, and through the nation we stopped at VFWs, American Legions, and we talked to our veterans and we asked them what's going on. Because again, like Sheila said, we don't want to assume that we know all the answers. We need to make sure that we talk to our veterans and speak to them and ask them, how can we help you best? And through that conversation, as we went through the country, they said, we really need our mental health needs met. The rate of suicide continues to go up. And these were not just young folks, but these were Vietnam veterans as well, telling us, hey, we don't have enough resources. We really need to tap into other resources, various resources. Some people were talking about the Veterans Administration being really great. Others were talking about, hey, we need other resources outside of the Veterans Administration. So, there were a lot of things going on across the nation that we just needed to hear and be able to bring back and then identify that there is, in fact, a rise in veteran suicide. Between the years of 2000 and 2010, female veterans alone, there's been a 40% rise in female veteran suicide. And again, during those same years, we've had a 13% rise in just across the board military male veteran suicide. So as compared to say the civilian population.
So how do you propose to save veterans' lives in our community?
What we want to do is to really be able to educate, because so many people talk about invisible wounds, but they're really not invisible. And my background, I have a master's in rehabilitation counseling, and Summer has a PhD in clinical psychology. So what we really want to do is to be able to educate on how to be able to recognize a lot of the things that are going on with the veterans, whether it be anxiety, combat stress, and to be able to, once those are identified, help with the resources to connect to them. And also what we'd like to do, what we heard as we were going across the country, so many times when they reach out to the different nonprofits, or let's say the VA, they're not able to reach who they need to. It takes 3 to 5 phone calls. So kind of help be the liaison, so to speak, and helping connect them when sometimes they're just too tired or exhausted or not in the right place to be able to do it themselves.
And maybe they don't have the resources, to be able to reach out to, let's say, the suicide hotline or the Veterans Affairs 3 to 5 times, because what they'll tell us is after 2, 3 times, we're done.
Sure.
We're done and we're suffering in silence. And basically, their wounds are not invisible. There are definite identifiers based on, watching somebody who is having crisis, who is going through some kind of trauma, PTSD, combat stress, anxiety. So we want to teach and educate about how to identify those factors as general population and as other people helping veterans and supporting veterans issues.
So we were talking earlier, and you had mentioned that you have a police or an ex-police officer who's a veteran. Are they teaching other police officers, or how is that working to basically to see what kind of signs there are to be able to help identify what might be going on?
Okay, so we talked earlier about how we're going to save or try and save lives or reduce suicide or crisis in our community with our veterans. And so from a large perspective or a general perspective, our programs are preventative, modeling, and then also crisis intervention. And as we said before, we're working with a police captain who has found that he has police officers who are veterans, military veterans, who respond to veterans in crisis out in the community. That helps save lives. because again, that helps reduce the crisis that is confronted by the veteran in crisis and that is confronted by the police officer. So together because of common situations or common issues, because they've both been in the military, they're basically able to make that human connection and say, you know, I was in the military. How can we work together? How can we resolve these issues that you're confronting now that's creating this crisis for you? And that naturally and organically creates that bond to really reduce that crisis in the field for those officers and for that veteran.
Because unfortunately what they were finding, especially in those situations, they're both trained to kill, so to speak, and sometimes in a crisis situation, the veteran is so escalated if they're able to know that this other police officer who's coming to talk to him is actually a veteran, they're able to connect on a certain level, and a lot of times it de-escalates the situation.
That's great.
It makes it.
And so we're really trying to work with our community law enforcement officers, first responders, to really, you know, see how veterans, who are these first responders, can really interact and really alleviate or minimize the crisis, and really be able to help these veterans in the community who are going through that crisis, connect them with various resources so that they're not feeling isolated, alone, that they have somebody to reach out to. That may be different than what they think is just the norm, like I have this resource or I have this resource, where communities have a whole list of resources that these veterans can reach out to. So when we go to the different communities, say like, you know, Prince William County or Stafford County, those counties are going to be able to identify specifically their resources and have a list of them that we can access and say, you know what, we have a list of things that we can give you and provide you, and we want to make sure that you're okay. So how
Very
can
good.
we help you, you know, even if we have to guide them there, you know.
Sure. Oh, that's excellent. So tell me about this documentary you've been working on. You've had a showing, and you're doing private showings of it right now.
Right.
Tell me a little bit about the documentary.
It's called Echoes from Afghanistan. If Sheila wants to speak to that.
We actually were lucky enough to be working with a great group of Marine veterans who were actually in Afghanistan between 2008 and 2009. And unfortunately, since they've came back to the States, they've lost 28 to suicide. And what we were trying to do is talk about the relationship that those 5 veterans had actually established through Facebook, through social media, to maintain contact with each other so they could help, let's say, deal with some of the issues that might have arose there, or even sometimes the issues when they come back home and trying to reassimilate in the community. And how do you have someone to talk to who understands what you've been through? You know, we're both military spouses, but you know, we don't understand a lot of times what the combat veterans have gone through, so having someone else who understands and someone to talk to and to be able to create those relationships, if they're not already there, with other veterans, to offer peer-to-peer support makes such a difference for them in their personal lives as well as stress management.
And I'm going to piggyback on a little of what Sheila had said too. So these 5 particular veterans met while being in the military, and they became friends. And through that friendship, they were able to follow each other as they transitioned out, separated from the military, and went their separate ways. And these 5 vets, one of them is still in the Marine Corps. And so what happened is, as they began to develop their careers or go to different states and, you know, try and establish their lives outside of the military, what helped them tremendously was keeping connected, like she said, through different means of social media, Twitter, Snapchat, Facebook, you know, all different types of social media, because that's what our younger generation now is doing. They're using those forms of social media to really stay connected. And as they did, you know, they were able to reduce that level of angst, depression for one another. If one of them fell out, they knew it because they talked to each other every day, every week. You know, they have constant communication with each other. So what one would do was go and fly out to the other and say, how can I help you, pal?
Right.
You know, what? And so this is what that documentary is all about, is educating about veteran peer-to-peer support network programs. And this particular group of guys is our model to show how you develop this while being in the military and as you transition out, be that you're separated, you retire from the military, because many times if you've been in the military for 4, 5, 10 years, you haven't had an interview, you were in the military. So the things that we've experienced as civilians, having to apply for jobs, go for interviews, they haven't done it in 5, 10, 15 years. It can be scary. it's a new feeling, it's an adjustment. And to have one another really helps support, you know, them feeling isolated, feeling down. They have that camaraderie once, they can still have that camaraderie through those veteran peer-to-peer support networks.
Excellent. Excellent. Well, thank you very much for being on our show today.
Thank
We
you so
appreciate
much.
it, and we hope to have you
Thank
back
you
on
so
here in the
much.
near
Absolutely.
future.
Thank you.
For having us.
Thank you.
Thank you for joining us for Community Conversations on What's Up Prince William.